Hi all, my name is Alexis Coleman and I am a senior at Millikan University. I will be focusing on the Nigerian culture and HIV and AIDS. Did you know in 2018, 1.9 million people were living with HIV and AIDS in Nigeria? There were 1.5% adults between the ages 15 and 29 that had HIV prevalence. There were 130,000 new HIV infections. There were 53,000 AIDS-related deaths. There were 55 adults on antiretroviral treatments, and there were 35% of children on antiretroviral treatments as well. And continue on, Nigeria has the second largest HIV epidemic in the world and one of the highest rates of new infections in sub-Saharan Africa. So a little bit of background on Nigeria. Nigeria has three major ethnic groups: Yoruba, Hausa Fulani, and Igbo. And the culture is multi-ethnic. There are 527 languages in Nigeria, but 7 of them are extinct. Most individuals that grew up in Nigeria knows how to speak at least 2 languages, if not more. Nigeria plays a important role in the lives of separate individuals and the society as well. Stigma and discrimination. Individuals living with HIV and AIDS are feared by stigma and discrimination when it comes to the health field. Stigma goes along with discrimination because it is defined as an undesirable or discrediting attribute that an individual possesses, thus reducing that individual status in the eyes of society. Discrimination in the context of HIV and AIDS is defined as a form of exclusion, a restriction of expression, marginalism, or prevention from access to something or services. So healthcare providers. In Nigeria, they often tend to neglect individuals that are infected with HIV and AIDS, which is a huge problem for the culture because of um, because of how many new infections there are in Nigeria. If stigma and discrimination is understood and barriers were removed, healthcare providers would know how to treat Nigerian patients to make them feel better about going into the hospital. What can healthcare providers do to communicate better? The first one is gain trust. The second one is making patients their priority. The third one is understanding their cultural differences. So, gaining trust with Nigerian patients can get them to be more comfortable in talking more about their HIV/AIDS infection, and plus, what stage that they are in if there is no information on them already at the hospital. Some ways that healthcare providers can gain trust is making a conversation with them about their culture before assuming anything and letting the patient speaks with no restrictions. They can ask them cultural questions and how they would like to be treated, and so on and so forth. The second one, making patients a priority. By making patients a priority is a form of building trust, but also makes the patient feel important. Responding quickly to their needs without showing signs or discomfort is a sign of showing that healthcare providers actually care and want the best treatment for the Nigerian culture. The third one is understanding their patients. Understanding patients would be a great way to get to know a patient and their culture. The ways that healthcare providers can do this is printing off documents from the internet about how to treat slash communicate with Nigerian patients with HIV and AIDS without neglecting them. Also, understanding patients will have a lot more Nigerian patients come to the hospital about their infection ra- rather rather than staying at home being sick. So in conclusion, I hope that everyone understood that that an individual in Nigeria that is infected with HIV and AIDS should be treated like a regular patient with a, I don't know, a normal disease, and not looked at in a different way because they are infected with HIV and AIDS. Healthcare healthcare providers can build better communication by learning information about the Nigerian culture, making them a priority, and gaining trust by listening to their problems. Thank you all for listening to my presentation. If you have any questions or concerns, please comment down in the comment section. Thank you.